Just when we thought it was over, COVID-19 cases are rising again across the United States, bringing back memories of the past few years. Experts warn that the summer wave of COVID-19 is more expansive than previous ones, driven by heat waves pushing people indoors and large gatherings. Despite the official guidance, stepping out too soon after infection, especially without a mask, could put others at risk. Symptoms of COVID-19 remain varied, from fever and cough to fatigue and body aches, but loss of taste and smell is less common now. Testing remains crucial. A negative home test doesn't always mean you're in the clear, so stay vigilant if symptoms persist. Isolation guidelines have changed. You can end isolation once fever-free for 24 hours without medication, but caution is still advised. High-quality masks are recommended if you must be around others after infection, especially to protect high-risk individuals. New vaccines are on the horizon, but if you're at high risk, consider getting last year's formulation after consulting your healthcare provider. For severe symptoms like chest pain or shortness of breath, seek medical attention immediately, as the risk isn't zero for anyone. Remember, self-care is vital. Rest, stay hydrated, and consider over-the-counter medications or antivirals if symptoms are severe. Take a test after symptoms or exposure if you are experiencing COVID-19 symptoms or you've been exposed to the virus. It's time to test, experts said. Remember, a negative home test does not mean you don't have COVID, Dr. Russo said. The symptoms associated with recent COVID-19 infections are similar to those we've seen in the past. They could be asymptomatic, or have symptoms like fever, cough, headache, sore throat, runny nose, diarrhea, nausea and vomiting, loss of smell and taste, fatigue, and body aches, he said. However, experts said it's a good idea to be extra cautious around high-risk friends or family members and/or people who have important events coming up that they don't want to miss, such as weddings or family vacations. Practice self-care and consider medication. Not everyone will need an antiviral medication to treat a COVID-19 infection. People with mild illness usually get by with over-the-counter medicines, like Tylenol. Point 4 experts also stress the importance of resting and staying hydrated during recovery. However, if your symptoms are severe or you are in a high-risk population, there are 3 antiviral medications available for COVID-19 treatment right now. 4 Paxlovid, nirmatrelvir with ritonavir, available to adults and some children. Veklury, remdesivir, available to adults and some children. Lagevrio, molnupiravir, available to adults only. These treatments may be expensive for people without health insurance. The commercial list price for Veklury is $520 per vial, 5, while Lagevrio costs over $9,006 and Paxlovid nearly $1,400.70. COVID-19 treatments work best if taken early in an infection. The sooner you begin treatment, the better off you are, Dr. Russo said. Call a healthcare provider for severe symptoms. If you're sick with COVID-19 and you start experiencing any of the below, you should contact a healthcare provider immediately, Dr. Russo added. Chest pain, confusion, dizziness, shortness of breath. Some people are at high risk for developing severe disease, Dr. Russo said, including people 65 and older and those receiving certain cancer treatments. Pregnancy, diseases that affect the immune system, as well as a wide range of chronic health conditions, including chronic kidney disease, chronic lung disease, heart disease, diabetes, and more, can also increase a person's risk. Point 8 COVID-19 infections have been rising in some areas in the United States. As of August 13, case counts were rising or likely rising in 25 states, per the Centers for Disease Control and Prevention. Health authorities have said you can quit isolating shortly after recovering from a COVID-19 infection. Still, experts said that may put others at risk, and it's important to distance yourself from high-risk people after an infection.